We will move on to the first session of this day two. We heard yesterday a lot about the challenges that the Nordic welfare system now is facing. Today, we will try to answer the question how to respond to the challenges, and can we also build something back better after the pandemic? We will start this session with broadening the perspective. Romina Buarini, she is the director of WISE, which is the OECD Centre for Wellbeing, Inclusion, Sustainability and Equal Opportunity. The headquarters of WISE is in France. Romina will now put a well-being lens on the recovery in OECD countries. She will talk about lessons from the pandemic and about a roadmap to build back better. Please, Romina, the screen is now yours.
Thank you so much. Good morning, Jens, and good morning, everyone. It's a real pleasure to be with you this morning, and congratulations for this very important initiative. I am uploading my screen and my presentation. I believe it should be visible in a second. Can you see it now?
Yes, we can see it. Perfect.
All right, so indeed, what I would like to do is I would first very briefly start by recalling how important has been the notion of well-being and the recent work that OECD did in collaborations, of course, with many of you in the Nordic region. And then I will concentrate my talk on looking at some of the findings from a very recent study that we released just last week, that looks at the impacts of COVID-19 on people's lives. And I will, from there, try to draw some lessons in terms of what sort of policies, what type of approaches are most suitable to ensure that the recovery strategies really are able to be fully inclusive, are fully able actually to improve people's well-being. And I'll finish up by giving you a sense of what are the next sort of avenues, next steps for research. Obviously, the economy of well-being stands as one of the most important agenda from the perspective of the WISE Centre. And it is a pleasure that, well, many of you, in fact, in the room today are actually working also on supporting and bringing forward this agenda. So really the idea would be possibly also to start a conversation with you on how we can collaborate on this objective. Very briefly, obviously, well-being is not something new, and it's like if I had to tell you that you're starting today talking about welfare. Of course, you have a strong tradition, definitely in the OECD areas. I would say that your countries are the ones that are strongest in terms of the tradition looking at the welfare state, but the OECD as well look at well-being in many different ways. We started back in the 70s when the Club of Rome was created, and the following connections with that. The first work on social indicators were also carried out at the level of the organization. You can see in this journey a number of important milestones, but what I want to focus your attention on is the fact that it's only in the last 10 years or so that the efforts at the level of the OECD actually have been accelerated. So really, this is when we started taking well-being very seriously, starting in fact from the measurement aspect of this agenda.
Romina, sorry, I have to say now your PowerPoint is not in the mode for showing the slides. So okay. It just was, but now it isn't. So if you can put it on maybe slideshow or something that we can see the slides. We only see them as small slides now to the left.
Oh, you see the so small side. That's a very good point, and I'm not sure how I can. Let me see. I'm sorry about that. Is it better now?
No, we can see now the actual slide you're talking about, but it's not in the slideshow mode.
Let me see.
We can now see the slide you were talking about the milestones.
Right, and you still don't see it in the right way. You see it small.
No, yeah, I see it small. Yeah.
Yeah, I'm sorry, I'm not sure I know how to actually change the format here.
But our friend Heli, She's the technician. She can also show your slides from
that would be great. I suggest we do that. So that,
so you can. So if you, Heli, show the slides, and you can, Romina, say, please, next slide or something. Yes, go ahead. Yeah, go ahead.
Yeah, very sorry. So you will. Okay, very good. Okay, so apologies for that. So last year we created the center, the Y Center, and this is really an attempt that the organization is making to ensure that we're not just looking at the measurement aspects of well-being, but actually we're also doing a lot of effort to mainstream it in the core of the policy design and the policy implementation. Next slide, please. Part of the work we're doing, in fact, consists of looking at what matters to people. That's really how we started looking at the notion of economic performance and social progress, and from that essentially derive a number of indicators that matters for describing and understanding people's well-being. But of course, in that we also very much look at issues related to SDGs, because these are agendas that are very much connected. Of course, as I mentioned, we don't only look at the aspects that relate to measurement, but we're trying to connect all the insights that come from measurement and indicators to actually the issues of policies. And finally, we are working, of course, not just to support across OECD countries' narrative, but also specifically to support and work in collaborations with countries in the OECD in a way that effectively allows them to sort of walk sort of the well-being journey in the best possible way. Next slide, please. Sorry, I can't now have. Okay, right. So what you can see right now on the screen is the OECD Wellbeing Framework, and let me be very brief about it. This was established 10 years ago, and I think it is important to stress that today it is actually used by more than 50% of OECD countries. So really, this is something that has influenced in a very deep way the practice of monitoring progress beyond GDP in many OECD countries. It is organized essentially in three areas. First of all, it does look at current well-being outcomes, and those relate to both economic aspects of people's well-being, but also at non-economic aspects. So we look at, for instance, the social, relational, and environmental aspects of people's well-being. The second element that I'd like to comment on is the fact that obviously we're looking at well-being from a dynamic point of view, where we're not just looking at the well-being today of current generations, but we're trying to understand how this is generated over time and how it can be sustained over time, precisely by investing in key resources that generate well-being. And this is what we call the capital approach, the capital theory approach, that consists essentially in looking at very specific stocks that belong to either natural or economic or human or social capital. And we know that these are essentially the pillars that drive well-being over time. And the third and final element I wanted to comment on is the fact that, of course, we are looking beyond the average. That was one of the very reasons why we wanted to go beyond GDP, because we know the aggregate picture don't mean very much when you want to understand the diversity of people's living conditions and their experience of well-being. And therefore, we're looking at how those different outcomes of well-being are actually distributed in the population. So we're looking at what we call horizontal and vertical inequalities, but we're also looking at deprivations, meaning at the groups, in fact, that are compounding many disadvantages in the various dimensions of lives. Next slide, please. So, in fact, interestingly, you can see in this chart the evolution of the practice of well-being in OECD countries. They're again starting from 2000 until today. And you can see that obviously until, so essentially during the first decade, from 2000 to 2010, most of the efforts, well, first of all, there were not so many countries that were actually engaged with such an agenda. And many of them were concentrating themselves mainly on the issues of measuring. And it's actually after 2011 that countries started going actually further than that. And in particular, they started embracing the well-being thinking in policy, meaning that they really started to put in practice and use well-being frameworks and tools, for instance, by deciding to allocate their budget or to take other policy decisions based on the possible impacts of those decisions on people's well-being. So it is actually really in the last few years that we started observing a very, very interesting emergence of a variety of practice in OECD countries that, again, are trying sort of to go much further and try to understand how, in fact, well-being can be integrated as a policy objective, in fact, as policy objectives, because we're talking, of course, of well-being as a multidimensional concept, but how really this can be done sort of in all stages of the policy cycles, and how this can be, in fact, worked out at the level of all levels of governments and different departments. Next slide, please. Now, and I'd like to go very, very quickly. Let me say a few words about the main results of our study that, as I mentioned, we published a couple of weeks ago. Essentially, the main point, the main finding is really that the pandemic has touched on every aspect of people's well-being. And today I'm just going to offer sort of a selection of results. I won't be able to comment in the details of what we have observed. Next slide, please. So when talking about the human cost of the crisis, we first of all must acknowledge the grave loss of life that was caused by the pandemic and the impact, of course, that this has had on those left behind. If you take an indicator, which is a relatively simple indicator, excess mortality, you will see we have found that deaths have increased by 60% on average across OECD countries between March 2020 and May 2021. And that actually implies a 7-month fall in life expectancy in 2020 alone. So this is really huge. Next slide, please. It's not just about, of course, physical health. It's also about mental health that has suffered tremendously during the pandemic. In fact, 1 in 4 people were at risk of depression or anxiety by the end of 2020. Among the countries where we do have some data, the incidence of depression and anxiety symptoms has at least doubled in many of those countries, for instance, in Mexico, the United States, and the United Kingdom. And while the economy has been recovering, and we heard that just last week from our latest projections in the economic outlook. So we also know that obviously it's not just the state of the economy that matters, but when we look at things such as feelings of loneliness and the share of people who actually felt out of the society, we know that these have not, in fact, decreased, and if anything, they actually have been on the rise since the start of the pandemic. Next slide, please. Very importantly, we saw in all OECD countries exceptionally extensive government support. This has played an important role in protecting average incomes, and this has also stemmed the tide of unemployment in OECD countries. Nevertheless, economic insecurity has remained high. And so the role for social protection now is really to make sure that this remains fully inclusive, and in particular that coverage is ensured for those typically the non-standard workers and those that don't benefit from standard or regular labor contracts. In fact, 1 in 7 people in European OECD countries are fearing that they are likely to lose their jobs. And more than a quarter of people in 34 OECD countries have been unemployed, discouraged from looking for an employment, or they have been only marginally employed in mid-2020. And if you look at the end of 2020, around 1 in 3 people reported having experienced at least one financial difficulty since the start of the pandemic. Next slide, please. So as the pandemic has continued to unfold, more people have been feeling worn out. In early 2021, nearly 1/3 of people reported feeling too tired after work to do necessarily household chores, with higher rates among women, younger adults, and particularly among those struggling financially. So this is, I think, the other quite distinctive element of this crisis. Of course, many workers could benefit from flexible telework arrangements, and this was key. for many, I think, to manage the challenges posed by the pandemic. But we also know that even for those that were able to telework, obviously at some point, the double burden of continuing to work and having to run the household, having to be in charge of the children, etc., those things really starting to have a very strong impact on people's ability to reconcile work and life in the best possible way. Next slide, please. Consistent with our well-being approach, as I mentioned, our report put a strong emphasis on inclusion and inequality of opportunity. And so when possible, because we had specific data, we did consider outcomes by gender, age, education, income, race, ethnicity, and more. Next slide, please. In fact, very few OECD countries collect systematic data on well-being by race and ethnicity. But in those where such information is available, we have seen some striking gaps, particularly in terms of mortality rates, but also unemployment and mental health. In fact, one, I would say, specific finding is that typically we see that disadvantage accumulates and intersects in ways that are not always easy to see in the data we have. And so we should keep in mind that if anything, the data and the numbers we have probably are understating how well-being challenges have been piled up for some groups of people. Next slide, please. The other group that has been particularly impacted by the pandemic in all its dimensions, economic and social, have been the youth. I don't think I'm revealing here anything surprising. This is, of course, something that has already been discussed, including by you in your conversations. In fact, what we see is that younger adults have seen some of the largest declines in mental health, social connectedness, and life satisfaction, and of course, job disruption. This is, in fact, a double hit, because we know that facing this well-being challenges, such a formative stage, such a critical stage in life and careers, obviously will have a very long-lasting impact for the years to come. And so this is certainly one area where policies should focus going forward. Next slide, please. Housing conditions and how we live together also took on new significance for well-being. Many of us, if not all of us, obviously had been confined, different periods of lockdowns. So essentially, we had to face new challenges, living and working from home. School and daycare closures, combined with the strains of the pandemic, have taken a significant toll on the well-being of parents, in particular with their children. And this is, in fact, something that is visible through the data that I'm showing this in the slides that looks at how life satisfaction has changed for people and families with children. Social restrictions also mean that those living without their partners obviously have struggled, and these are also the ones that obviously felt the most lonely. Next slide, please. So we heard a lot about spending on physical infrastructures to stimulate the economy. Anytime that we hear about resilience and reconstruction plans, including in the European context, but not only, we obviously are hearing that our governments are thinking and, in fact, taking steps, not just thinking of investing in infrastructure, but actually our report certainly emphasizes the need to invest in our social infrastructure during the recovery. Next slide, please. The pandemic, in fact, has reversed the decade-long decrease in the number of youth not in education, employment, or training. So this is when we started looking not just at the short-term consequences of the pandemic, but actually when we look at the extent to which the pandemic has hit what we call the human capital. And you may remember from the framework of well-being that I presented to you at the beginning of the presentation, I was saying, this human capital is one of the factors that we know is responsible for explaining performance of well-being over time. So, this is to say that anything that has happened during the last 2 years that has in fact had an impact on those stocks of capital is something that is going to stay for a while. Next slide, please. And here you have another chart that suggests how the human capital of people in OECD countries, in fact, has been affected by the pandemic. In fact, what we see is that more people adopted unhealthy rather than healthy behaviors. Of course, the pandemic sort of really changes people's habits. In some cases, these were positive. For instance, 1 in 5 people reported exercising more, but actually, on average, more people adopted unhealthy behaviors, such as, they started drinking more, they gained weight, and also they smoked to a larger extent. Next slide, please. We have also seen worrying signs of social capital being eroded as the pandemic has worn on. At the beginning, there were many heartwarming anecdotes about communities coming together. As times has passed and the realities of the pandemic have become clearer, actually a majority of youths now feel that their countries are more divided than before the crisis hit. Next slide, please. And after an initial boost at the start of the pandemic, trust in the government, the police and the media started to edge down slowly between April, May 2020 and January, February 2021. The data on this slide refer to European OECD countries, but evidence from non-OECD OECD countries also suggests that trust in government has started moving back towards baseline levels in early 2021. And of course, this is a worrisome I would say finding, because we are not out yet of this pandemic, and we are hearing those days, of course, in all OECD countries, new restrictions being adopted. There is also still the issue of vaccination rates, and so every type of policy response, every type of measure that governments are taking needs obviously to work. I mean, to be fully effective at work really needs to be accepted by citizens, and so if trust in institutions is not high, clearly, this is not going to work. Next slide, please. Of course, as I mentioned, we're looking at inequalities in well-being during the pandemic, and we look at women. Here you have a quite interesting chart. We look at really at all how sort of the lives of women have changed during the pandemic, but we also look at how the presence and the contributions of women in the society and the politics during the pandemic has changed. And interestingly, this chart shows that women were underrepresented in COVID-19 task force. So there is a mixed picture in the sense that in some cases, in fact, the progress toward gender parity and diversity in politics continued, because if you look at some indicators, such as the share of women in politics, in fact, it has increased in some countries, but nevertheless, a chart like this one still shows that women, are not playing the role that they should in the society. Next slide, please. So how do we go from there to policy implications? So what does it mean to take well-being really at the core of the policy response? Next slide, please. So obviously, OECD countries each went into the pandemic from very different starting points. They each have a unique constellation of policies, settings, and priorities. So it's hard sort of, to come out with a straitjacket recommendation or sort of one size fits all approach. This is not what we want to do here. Nevertheless, the analysis in our report suggests some common policy concerns in the wake of the crisis. And as we have just heard from the key findings, some common challenges really remain, and they span current well-being inequalities and lack of opportunities, but also future well-being concerns. Next slide, please. A very important aspect of well-being, of a well-being approach into policymaking is this ability, in fact, to deal and handle challenges in a very interlinked and interrelated way. You have understood that well-being is a multidimensional concept. This is something really that has implications for a number of aspects of people's lives today and tomorrow. So it doesn't make any sense to take a piecemeal approach to well-being, to say, I'm going to just to take one little measure in this area, because we know that this will have consequences of repercussions and implications for others' well-being dimensions. And here you have an example. In this chart, you can see that during the pandemic, the unemployed and those that had difficulties making ends meet were much more likely to feel lonely compared to the population as a whole. And that, I think, just reminds us the big impact that economic exclusion across people's lives. And so we cannot tackle an issue such as loneliness without obviously looking at the life circumstances that cause people to feel lonely and left out. Next slide, please. The other issues, of course, is that the pandemic, in a way, has also reminded us that there are many other challenges that countries need to face in building back better. So we can't have a short-term approach to things. Here you have an interesting slide that actually suggests that, well, looks at essentially at the global energy-related CO2 emissions. One of the very first facts when obviously all the economy went in lockdown, everybody said, well, this is so good, this is going to be so good from a pollution point of view, from a climate change point of view. But actually, what we see in this chart is that the CO2 emissions have proved to be particularly resilient to the pandemic. And in fact, after considerable reductions in both economic and social activities, the crisis prompted a 5% fall in total energy related CO2 emissions. But in fact, already at the end of 2020, those emissions were making a strong recovery. And so clearly also that suggests how challenging is going to be to reduce emissions by even 10%, which is one of the obviously targets of some OECD countries. And let alone getting to net zero, which is the other obviously big commitment that many countries made in the context of the recent Glasgow meetings. Next slide, please. So what does it mean, or what does it take, to put a well-being approach to policy in the recovery? For us, it means four things. We're calling it sort of the recipe of success, and really it is articulated around 4 R's. The first is refocus policy actions on outcomes that matter the most to people and the most urgent priorities, again, from the perspective of increasing people's well-being. The second R is about redesigning policies and programs, taking a multidimensional approach. I'm going to show in the next slide some examples of triple win policies that address concerns of well-being today, but also sustainability of well-being and lack of opportunities. And the third R is about realigning across policy departments and levels of governance. I already mentioned that we are talking about having integrated approach here, integrated approaches, holistic approaches, all of the government approaches. So again, this is not the responsibility of one department. This is the responsibility of all the departments. And so it is really important to put in place strong coordination mechanisms across the boards, whereby or to which the departments can work together to activate in a positive manner all the well-being policies that are needed. And the final R is about reconnecting people and public and private institutions that support them. I was obviously talking about the impact of pandemic on social capital, in particular on trust in institutions. Here really using well-being frameworks can provide those opportunities to actually underpin and steer a strong dialogue with the stakeholders around their priorities, and are also those, in fact, those priorities can help manage some of the policy trade-offs that governments are facing. Next slide, please. So quickly, to give you an example of what very concretely the triple win policy actions approach means. So in the report, we did analysis essentially that shows that the following policy channels will be particularly good, particularly effective to ensure that we are really improving or mitigating actually the decrease of well-being that we saw during the pandemic. At the same time, building also strong foundations for well-being to be sustainable over time and for well-being to be distributed in a fair and even manner across the populations. And so those channels are the following. First of all, put in place policies that can really catalyze the creation of sustainable, inclusive, and high-quality jobs. Obviously, that includes a strong role for social protections into that. Second, using lifelong learning to reduce inequalities of opportunities, particularly for those, of course, that are least, I would say, connected to those opportunities of learning. Third, very importantly, take strong actions on strengthening mental and physical health promotion and prevention. Fourth, as I mentioned already, using all of the government approach, but in particular, directed it and oriented to raise the well-being of disadvantaged children and young people. And finally, supporting trust by encouraging meaningful citizens' participations, including in the design of policies. Next slide, please. So let me finish by telling you about one of the projects that connects with the results that I've just presented. And in fact, we are finishing today a 4 days conference that we organized to launch a new project in the White Centre about mental and health and well-being. The idea is really here again to take an integrated policy approach and look at the connections between mental health and the other dimensions of well-being. Next slide, please. So you have a chart here that show that, in fact, the ratio between people with mental distress compared with those without mental distress, in fact, do less well along a range of well-being deprivation. In particular, we see that the largest gaps are seen in life satisfaction, health including chronic illness, material deprivation, job satisfaction, satisfaction with time use, and satisfaction with personal relationship. And so really from there, one of the, we're going obviously to do additional analysis, and we will publish a report related to this analysis in 6 months approximately from now. But clearly the main, I would say the main points of that report and the type of recommendations that we're going to put in place is certainly about expanding the accessibility of mental health services, again, in particular in those geographies or for those communities that we know are struggling the most already. And in fact, it was quite alarming to look at already before the pandemic hit. If you look at the numbers of people in OECD countries that tell you that they would like to benefit from some mental health service, actually, and they cannot just because those services are not available, we're talking about very, very large proportions of the population. Some countries it goes, to numbers such as 70%. So 70% in the population say we wanted to have, some consultation on mental health. We couldn't because such services are simply not available. So this is certainly one area of focus where from now onwards our working wise is going to be particularly, I think, insisting in terms of recommendations. My next and final slide to tell you about, of course, this is not, obviously most of what I presented insists and sort of looks at today's situation. This is about how we can engineer a recovery, again, that really makes the most of, I would say, the potential of a well-being approach. But we know that the well-being approach is something in a way that can inform also the structural thinking and policy making, so the medium and long-term thinking. Here, let me just refer quite quickly, obviously, to the economy of well-being work that we did together with Finland during their 2019 Finnish presidency of the European Union. And in that piece of work, we conceptualized and we quantified actually the potential of the economy of well-being. What do we mean by economy of well-being? Essentially, we mean a very interesting virtuous circle between the investment in people's well-being and economic prosperity and sustainable development. So it is a way essentially to frame a concept whereby we're not, saying you can't have well-being and development or growth at the same time. You can, there are very specific actions to take. In that approach, in that paper, we insisted very much on taking actions on education, healthcare, gender equality, and social protections. And those actions obviously are, it's not just about the money you invest, it's how you invest it, the type of policies you make in those sectors, but also how through those investments and through those actions, you very concretely can expand people's opportunities in well-being. So here again, it's very much this idea that there are some basic public goods that we think the welfare state is there to provide to people, and in particular to the most disadvantaged one. So this is also the framework in a way that will guide, I would say, some of our forthcoming efforts. And so it is really with respect to that I hope that we will be able to collaborate with all of you, with the Nordic Council of Ministers, because of course this, I would say, this framework in a way is one that you know very well, and I probably has been with you, with your minds, with your practice, since a while. And so the idea is how do we can actually power it even more, and I think perhaps in the face of the new challenges indeed that economies and societies are going through today, but also what new type of research tools we need to put in place to ensure that these are again notions that are well understood by everybody and by all type of departments and different stakeholders. So I am done, and so let me thank you very much for your attention. Thank you.
Thank you, Romina. A very interesting presentation, and also very professionally handled with the slides. Thanks, Romina. You said here at the end, you talked about the Nordic Council and the Nordic Council of Ministers. I would like to hear just briefly from you, what role do you think that the Nordic Council and the Nordic Council of Ministers could play for advancing a well-being agenda at the European and the OECD level?
Well, to me, it's a very essential role, because as I mentioned, in a way, you certainly are. I mean, what I'm saying, the Nordic Council of Ministers. So really the sort of the platform that constitutes is the one that has the largest experience on the welfare state. It has the deepest understanding of what is people's well-being, and so there is all that I think wealth of knowledge is something that could benefit the Union, I mean European Union, but also of course the larger group of OECD countries. So experience, wealth of knowledge, that obviously includes data, I mean research, etc. But it's also the political commitment and leadership. I mean, this is also what we need. I mean, we know very well, those are elements, having strong champions of the concept, having leaders that believe into the concept, that are able to push it always at the forefront, the very important thing, when decisions are taken in Europe, but also, in places such as the OECD. Of course, the OECD, it's a completely different organization as Europe. We don't have any legislative power. We can't obviously prepare policies ourselves. We can't design or define policies ourselves. We just inform policies. But certainly, I would say that the Nordic Council can be the strongest voice. I would even say in the world, to really again push this well-being notion going forward. And perhaps to finish quickly, to say that what we need to do now, and this is really one area where I think it would be great that the Nordic Council could partner with us, is creating a space where governments can come together, the ones that have pioneered those concepts of well-being, the ones that have taken steps to put it in practice. So creating the space where again those governments, or Nordic Council, ideally comes there together with us, together with the other OECD countries, and just share what they have done. They share the vision, and really they can drive in a very powerful way this agenda. So there is a very specific action, I think, that can be taken, and so we will be very delighted to hear thoughts and really join sort of forces with you in a very strategic manner. So again, I think it takes many different it's aspects of this work, and it does require continuous sort of technical work, research work, but it's also obviously very much about again the political agenda and this sort of strong sense of directions that you want to give in this very critical moment in time.
Thank you, Romina, and enjoy the rest of the day. Hope to see you soon again.
Thank you.
Thank you. Small changes in the schedule. Somia Joshi and Minna Sinkkonen will switch places now in the schedule. You know that this forum is arranged by Nordic Welfare Centre in close collaboration with the Finnish presidency of the Nordic Council of Ministers. We will now hear more of what is going on during the Finnish presidency. Our following speaker, Minna Sinkkonen, she's a development manager from the Finnish Institute of Health and Welfare, THL. Minna is going to talk about the current state of mobility of health information between the Nordic and Baltic countries. She will present a big healthcare package 2021-2023. Please, Minna, go ahead.
No, thank you so much, and I really want to thank you for this opportunity to inform you about our current development work. And I will start by sharing my screen, so hopefully you can see that now. So like already mentioned, I come from the Finnish Institute for Health and Welfare. And during the Finnish presidency, we have been coordinating the health package of the chairmanship project, World's Smoothest Cross-Border Mobility and Daily Life Through Digitalisation. What we were then considering is that, of course, the Nordic countries are already very digitalized, especially between Finland and Estonia. We already have a functioning e-prescription. But really, how to measure that, how well is information actually transferring between the countries, and how committed countries are to get to this target. During the first year, then we conducted a big background analysis of the current situation, and the publication can already be found in the Norden pages. And in addition to that, we also held a seminar at the end of November and beginning of December to discuss the results of the background analysis. Because it seems that there are still a lot of not only technical, but semantical, organizational, and legislative barriers to really get forward together with this issue. Then based on the results of this report mentioned and the discussions that we held in the seminar, we are going to continue the development work. But of course, we will work very closely with the ongoing processes in the digitalizations that are in progress in EU working groups, and also in the Nordic Council of Ministers different working groups. And I think many of you also know that Sweden has been very active with distance spanning solutions in services, but now they are also continuing with their new project, IVOPD, Vård och omsorg på distans. And of course, we work in very close cooperation with our colleagues. Actually, we're going to have the steering group meeting today afternoon. Of course, it has been quite challenging to talk about freedom of movement during these difficult times of the COVID-19, but of course we want to look ahead to the future and think that this is not always going to be the case, because the mobility is also a very important issue in our Nordic and Nordic cooperation. What we looked a little bit at our background analysis is that when we talk about the areas where the people are actually moving for different reasons, most can be identified quite easily. And as you can see from this presentation, like I already mentioned, there's a lot of mobility between Finland and Estonia. And this is not only tourism, but also mobility of people being employed in the other country. Also very important points of movement are in the northern areas between Sweden and Finland, and of course here in Åland Islands, where we think that also the language issues can be challenging. It might not always be so easy to get Swedish services in Finland, although this should happen, but it doesn't always work that way. So we really want to look at the future, that we will be part of supporting the mobility between the Nordic and the Baltic states. Then I wanted to share a little bit of the discussions that we had in our seminar last week. And I think we had this kind of a reporting solution that we had a drawer, because I think this is a very good way to sort of like reflect in one picture on the discussion that we had. And mostly what we concentrated on is that if you have a service ready, then people will use it. So people are usually the driver of the change. And what we should be doing in the future would be to sort of like enable that this service would be available for people to use, and to concentrate what kind of applications people would need in their daily life to promote the mobility between countries. A very big thing also that we discussed is the European ID. That's how this is also a bigger issue in developing this kind of mobility. That's how do we identify ourselves in different systems when we travel or move from country to country inside European Union or Nordic countries or the Baltic countries. So this is also a very big issue to be discussed and promoted overall. But what we will do next is that we will together with IVOPD to get the numbers right, that how many people are moving and what type of reasons are driving them to move from country to country, so we can really then start discussions with politicians that this is the issue and these are the things that we really need to get moving forward to enable people to move. And what we also celebrated, and I think this is also a very good place to celebrate it too, is that we should always have this kind of healthy Nordic Baltic competition, that once another country gets a system functioning, then we can learn from each other and cooperate and then form a better future for ourselves. So I think that was all from me today. I understood that there's some tightness in the schedule, but thank you very much. And please, if you need any more information, be in contact with me. Thank you.
Thank you, Minna. It was a great presentation. I have a question for you, if it's okay.
Yes, of course.
When you talked, for example, about the e-prescriptions here, what would you say are the main challenges of mobility of health information, for example, then e-prescriptions in a Nordic context? Why is there so many problems? Why can't we get them?
Well, I would, because I'm a social scientist here, and of course the political commitment and working together is always the sort of like the best way to move forward. But I would not only say that it's in between the countries, but when we took a look at the information systems nationally, also in Finland, that they are regionalized. So it's also an issue which I think IVOPD will address more, the Swedish project, that how do we even get the information moving inside the countries, because it can be in different forms, we can use different semantics, and especially when we come to the patient summary, the sort of like what is included in the patient summary may not be similar between countries. But I really do believe that once we work together and get the political commitment, we can do this.
Mm. Thank you, Minna, and good luck also with your important meeting this afternoon.
Okay, yes, thank you.
Yeah, thank you, take care. We will now continue this session with digitalization and new technologies. When we're trying to build back and hopefully build back better, we talk a lot about digitalization and new technologies in the welfare state. What could the role be? And we have a great expert here to answer that question now. Her name is Somia Joshim. She's an associate professor and head of research at Stockholm Environment Institute in Sweden. Now, please, Somia, the screen is yours.
Thank you. Hopefully you can all hear me, and I'll try to make this presentation full screen.
Yes, it's working.
It's working. Perfect. All right. So hi, everyone. I'm Soumya Joshi. I'm head of division at Stockholm Environment Institute. If you see here the front screen of my presentation, this image was generated by AI, so bear with me. It's not my aesthetic. I was just curious to see what it would throw back at me on the role of digitalization in the welfare state. So very briefly, what is the terrain we will cover here? Firstly, I would like to take you through an understanding of what the welfare state is and what is the role of digitalization within. We will look at some of the visions of what sustainable futures could look like or need to look like in the face of the current environmental crisis. What are the technology disruptions and how do we build back better? I will highlight this with two case contexts, namely mobility and health. And finally, end with some brief reflections on infrastructure inequity that might emerge. So the first question that I would like to look at is, how are the Sustainable Development Goals fitting into the paradigm of the welfare state? So as you might recall, Sustainable Development Goals were a response to a new set of common development challenges and a recognition of the increasing interconnectivity of global systems. They were, in a sense, a reflection of a new political context in which the economic and political centers of gravity were shifting to new regions, more eastward and southward. And the fact that even as the world became so much richer in the past 15 years, the benefits have been unevenly distributed and the inequality within countries and between countries is growing. So just to give you some background first on what is the situation we're in, precisely because of the voluntary nature of the pledges around the Sustainable Development Goals and the technicalities and loopholes, decisive global action today to reduce emissions has been delayed considerably. You can see on the graph on the right-hand side, this massive gap between what nations have committed to and where they're at in terms of their actual trajectory. In terms of global CO2 emissions, we can look at it across sectors. You see electricity, energy use, transport, manufacturing, and the number of countries announcing pledges to receive net zero emissions over the coming decades, as you have seen, especially now after the recent COP, they continue to grow. But the pledges by governments to date, even if fully achieved, fall well short of what is required to bring these energy-related carbon emissions down by 2050. You have a visual here, which shows you where we are at the moment and where we need to be, and what our current policies are taking us towards, and how do we need to readjust them or adapt them in this climate. So where does digitalization fit in this context? As you see here, it's not alone. There's human capacity and demography, there's consumption and production, decarbonization, energy, food, biosphere, smart cities, and digitalization is one node in this transformation. Digitalization is not only an instrument, as it were, to resolve sustainability challenges, it's also a fundamental driver of disruptive and multi-scalar change. It provides entirely new and enhanced capacities, and thus serves as a major force in shaping both the systemic context of transformative change and future solutions. Now, there is significant inequality between and within societies. This is something, a quote here from Rockstrom, which shows that billions will be left behind, and there's overwhelming evidence of rising global risk due to ever-increasing human pressure on the planet. How do we ensure future sustainability for all within this context, an Earth system context between planetary boundaries? Now, often people talk about digitalization, but very seldom do we go into what does it really include. So just let me break it down for you a little bit here. Primarily, we're talking about three things here: automation, a platform economy, which is very highly relevant for the welfare state, and a data-driven radical transparency, be it from supply chains or to policy making. So the digital revolution, if you call it that, includes virtual and augmented reality systems, additive manufacturing, artificial intelligence, AI, deep learning, robotics, big data, Internet of Things, and of course, automated decision-making systems, which, as we saw from previous speakers as well, that there is a great relevance for that, especially as the Nordic countries are taking a lead in this area, for example, in health. It is said that digitalization is the driver behind the acceleration and accountability when it comes to achieving our sustainable development goals. Now, acceleration towards sustainability goals can be triggered through digital technological innovation if it's applied in multiple interconnected policy areas. So what I'm trying to say here is it should not be seen as a standalone. Artificial intelligence, the Internet of Things, all these things that we listed before is a support mechanism and could, if you look at it in the current pandemic context, have enormous benefits, both in terms of supporting epidemic prevention or increasing the efficiency, security, and transparency of outbreak reporting, reducing the spread of health misinformation, among many other benefits in public health, health research, and medical practice. Now, more widely speaking, COVID-19 pandemic has highlighted the transformative role of digital innovation within education, work arenas, and in the welfare state. Digital technologies also have substantial potential for application in food, transport, urban development systems, and a wide array of other areas. Now, one caveat that we should really consider here is although new technologies can accelerate progress towards a better human and planetary health, they should be based on models and values that account for structural biases, anticipate risks, and distribute those benefits fairly across society. So we must always be mindful of how our own inherent biases and structural inequities can be replicated through digitalization. Now, there is a significant gap between the rhetoric and the reality of digitalization. Digital transitions of recent decades have perpetuated or even triggered resource and greenhouse gas intensive growth patterns. So we have this tendency to repeat the same pattern. Access to services, now we can break that down into physical accessibility. So for example, physical distance to a service, how close are you to your nearest health center? Or economic accessibility, is it affordable? Is the service being offered affordable to all segments of society? And the third is institutional accessibility. How are norms, values, and laws, how do they constrain or favor access in a way? As the Nordic region increasingly relies on digitalization to secure equal access to healthcare and social care, digital accessibility becomes imperative in this context. Now here, we can talk about access to a digital infrastructure such as broadband, as well as possessing the skills and knowledge to use these digital solutions if we don't want to replicate those divisions. Now, to give you some examples of how this plays out, the first one looks at distance health. And here, in conjunction with this forum, we have launched a report for anyone who is interested to read. It's a policy brief and a report that talks about the results of our study. What we looked at here was a municipality in the north of Sweden and the virtual health centers there, and what was the knowledge bridge between the accessibility to health services and the impacts on the environment. A better knowledge of likely synergies and conflicts in this case is very helpful, we found, for identifying potential allies and opponents based on interest in issues other than the policy's main focus. So you might be setting out to allow people in remote rural regions across the Nordic to have access to health services. That could be your main policy focus. But at the same time, you're also looking at what are the environmental gains, what is the CO2 reduction, which was one of the results of the study. We found that the scenarios presented in this study indicated reduction in travel distance and hence reduction in CO2 emissions overall due to physical visits to the VHR. This is in line with other studies that report climate benefits from digitalized solutions in the health sector. The COVID-19 outbreak has helped the implementation of digital solutions take an unprecedented leap forward. One example is video consultations in primary care. Video consultations were implemented quickly in regions and municipalities, as we saw across the Nordic region. Now, acknowledging here the necessity of a swift implementation of new models of healthcare in the face of COVID-19, healthcare professionals and health researchers have emphasized the need for evaluating what do these practices really change. Because change is not merely installing a new technology such as a video conferencing system, but introducing and sustaining major change into a complex system. So the need for a remote healthcare solution where doctors and patients can avoid physical contact has shown that accessibility is a crucial factor in this rapid implementation. The second example I wanted to show you was from the transport sector or mobility. And this is reporting from another project that Stockholm Environment Institute is leading called Fossil-Free Futures. Now here, our findings showed that distance to healthcare varies greatly. If you look at the Sweden context, reduced car ownership is one of the objectives of the fossil-free transition in the transport sector. But how could this have a knock-on effect in terms of access to health services? You remember the point I made earlier about you have a main policy area and you have the other connected areas that you can impact. And how can this be considered in transition policies as we go forward in both the transport and health sector? If you look at the right-hand graphic here, you see 4 clusters. This is based on a demographic analysis looking at average distance to healthcare, the population share, car emission share, and the consumption patterns in the region. And if you look at the bottom right corner, you see cluster 4 is the most vulnerable because you see that they have a large distance to healthcare. It's a fairly large population share. And how does this compare to other areas or other clusters which have a higher population density or more urban areas are at a lower risk for poverty? One thing to consider is who is this sustainability transition really for? There is a lack of systemic and strategic analysis at the moment of the overall effects of welfare, growth, accessibility, and equality. This fails to identify the groups at risk of losing out on the sustainability transition and to develop strategies, transition policies that will ensure that they are available in this fossil-free future. Now, different groups obviously have different voices in the design of policy instruments and packages of measures, and this has consequences on how they are designed and whom they benefit. The greater the insecurity people experience in the run-up to a transition, the longer it takes, we have found, and this drives up both the climate impact and the conversion costs. An additional dimension to consider, and this makes transition more difficult, is that a group that is overrepresented in decisions, men, high-income earners, use the car more and this thereby have a more negative attitude towards measures aimed at reducing car use. For example, policies that would promote walking or cycling in urban areas as opposed to driving. And this unrepresented area, which is mainly women and low-income people, have less of a voice in this decision-making context. So we have to really think how that has knock-on impacts, the gender divide, the digital divide. How does this have impacts on how we design and implement our policies? This brings me to the topic of infrastructure inequity. This has to do with access. So for example, distance, this could be rural, urban, it could be digital divide, it could be the policy landscape. Or it could be agency, which is your ability to shift levers for change. What could these levers be? For example, regulations, policy, financial measures. Now, we have to be mindful. Are we reinforcing existing structural and systemic inequities? Because one of the major risks of sustainability transition is overemphasizing individual responsibility and relying too little on structural, systemic, and collective solutions. Recent studies have shown us how resources such as, for example, grants, subsidies, incentives, financial incentives intended to encourage sustainable behavior often flow to people with higher incomes who can afford to invest in solar panels or electric cars, whereas the really disadvantaged segments of society for whom these policies need to be targeted, they get left out. So how do we design for justice, and what kind of justice are we talking about? We could be talking about distributional justice. How are the benefits and burdens of this sustainability transition of digitalizing within the welfare state? How are the benefits and burdens really distributed? Are they distributed in a just way? Procedural justice, who is included in this decision-making process when we talk about building back better? And transmission and recognition justice, what populations are excluded from the commitments towards transformation? So some concluding reflections from my side. On the left-hand side, you will see this very important new image that has arrived in academic circles that look at sustainability transitions. This implies that a transformative change goes beyond building back better by advocating and generating a consensus for a nested model of sustainable development. Many of you might have seen this picture of the circles of economy, society, intersecting in a very small area, whereas the nested model believes they come together in this way. Such a model embeds the economic domain within the social, so the economic serves the social and environmental domains, in contrast to the dominant sustainability models of intersecting circles. If anything, the COVID-19 pandemic is an opportunity to reconfigure the relationship between these three domains of sustainable development, instilling new norms that view the economy not as an end goal in itself, but as a means to improve human and planetary health and well-being. This approach calls for a regenerative and distributed model committed to social and economic justice. Thank you. I'll stop there.
Thank you, Somja. Really, really interesting stuff you had there. And I remind you also, participants, you can ask Somja and the other speakers questions also in the chat. I have one question for you, Somja. And this might be a tricky and a hard one, but when you talked about that we tend to repeat the same patterns when we move kind of from a manual to a digital world, because we humans build the artificial intelligence and the Internet of Things and so on. How can we break the pattern? What can we do? I mean, it's in our heads, I know, but what's your suggestions?
Yes, I think that's a really good question because, as you say, many of these biases are inherent and hence it's replicated in our design of technologies. And I think the first step is to acknowledge that there is inequity in the first place. So in the talk, I try to show what this inequality might look like. It might look like you might have access to a digital virtual health room, but if you do not know how to use it, or if you cannot access it because of a poor internet connection, you're left out. Especially aging populations in the Nordic context could be left out of this digitalization drive. So if we're mindful of these inequities that currently exist, then we can redesign our sustainability transitions in a more regenerative pattern. So correcting for these errors in a way to try and make sure that we don't have algorithmic biases in our AI systems. We don't assume that fast electric chargers should be in the most well-off areas in our cities. We should think about rural areas, which until now have been left out of this discussion. So things like that, step by step. But of course, it's not an easy process. It's about always reflecting, being critical of how we design and implement such solutions.
Another question for you, Somja. Are you optimistic or are you pessimistic when talking about building back something better after the pandemic?
I think one has to be a hopeless optimist to be able to even suggest this transformative way of redesigning. So yes, I think I am optimistic.
Thank you, Somja, and take care.